Health workers have attributed majority of dead on arrival cases at facilities to the inability of some members of the public to use cardiopulmonary resuscitation or CPR techniques to help victims regain consciousness. About 80% of cardiac arrest cases are usually recorded either during a stampede or in times of disaster, and these usually occur outside the hospitals. Health workers are worried such victims die on arrival at the hospitals because relatives or friends who handle them are unable to perform basic CPR techniques.
Those of us who work in the hospital realize that most of the time patients are rushed in and they are dead already. We call them BID, or dead on arrival. And I believe some of them could have survived if there was enough knowledge on reviving them at home, because that is the teaching. The moment you attempt to move them to the hospital, you lose the very, very short chance that you have to try and revive the patient by way of getting the heart starting again. Even though most of such patients will still die, at least about 10 to 15% can survive if the right things are done. And that is what we want to advocate.
The Emergency Medicine Society of Ghana and the Muslim Health Workers Association of Ghana, in collaboration with the Federation of Islamic Medical Association, are stepping up community advocacy to sensitize the public on basic life-saving methods in times of emergency.
We're able to use the mannequins and then the AEDs to train over maybe about 100 participants, okay, to have this very important basic skill that every lay person should have. As an association, our advocacy is mainly to remodel our communities through health.
Some students and lecturers of the Kwame Nkrumah University of Science and Technology were taken through CPR procedures, recovery positions, and choking management.
The exercise was very interesting. It is more of like an exercise for a reality check. You will see most of the citizens have some kind of erroneous perception with regards to such activities.
I would like to say thank you to this organization for collaborating together to bring this wonderful session to us. Hopefully we'll be able to take it to the community. I have a suggestion that we should not limit this kind of education to the academic community. We should really go to our communities where we live.
From the session, we realized that what I thought I know, if I was to apply it, I would have killed a person.
The health workers believe that helping the public gain such knowledge will help save more lives. Health workers have called for more awareness creation to get the public to understand basic life-saving techniques in times of emergency. Hafiz Tijani, Citi News, Kumasi.